Hello and welcome to another live broadcast with MedStar Health. My name is Sarah Ridenauer, and we're joined today by two of our urgent care experts, Amanda Joy, certified emergency medicine physician assistant, and Randall Wiley, primary care nurse practitioner. As we approach Valentine's Day, when millions of people express their love for one another, we're here to discuss a very real but sensitive topic that is tied to romantic relationships, and that's sexually transmitted infections or STIs. This is, of course, not to say every intimate encounter will involve an STI, but there are some important facts that everyone should know to protect yourself and your loved ones, as well as learning the steps to take if you think you might have been exposed to an infection. So share this broadcast with your friends. Give us a like to let us know you're watching. And if you have any questions for our experts, please leave those in the comments below. Before we get to our questions, let's get to know our experts a bit more. Our experts are here to share essential information about STIs in an open and caring discussion. And first, I'd like to introduce certified emergency medicine physician assistant Amanda Joy, who's with us here today from MedStar Health Urgent Care, where she serves as an associate medical director. Amanda sees patients of all ages at MedStar Health Urgent Care centers and provides immediate evaluation and medical care for all types of injuries and illnesses, including sexually transmitted infections. Next is MedStar Health certified primary care nurse practitioner Randall Wiley, who specializes in men's and women's health, pediatric care, mental health, prevention wellness, and holistic care, and chronic disease management. Brandy is certified by the American Association of Nurse Practitioners and currently sees patients at MedStar Health Primary Care, St. Clement's office in Leonardtown, Maryland. Welcome, Amanda and Randy. Thank you again for joining us and taking time out of your day to answer our questions. So let's get into those. I'll start off, Amanda, what is the definition of an STI and how is it different from an STD?
That's a great question. So often the term is used synonymously, but it actually means a sexually transmitted infection is either a virus, a bacteria, it can be a fungal infection, a parasitic infection that one can get through sexual contact. A sexually transmitted disease often is what the symptoms that you have related to having the STI. So one is more what happens after you have been exposed to the virus, and one is actually, or bacteria or fungus, and one is actually what the actual infection itself, so initial infection.
Okay. And how can STIs impact people's lives?
So they can have a profound impact on health. If they're left untreated, there could be serious consequences. Syphilis, for example, can lead to neurological and cardiovascular disease. Many of these can cause infertility. There could be scar tissue leading to ectopic pregnancies or tubal pregnancies. You can have stillbirths. With HIV, you can have AIDS, you can have other opportunistic infections. There's so many impacts on people's lives. And unfortunately, drug resistance is becoming a big threat to treating these STIs worldwide. So it's important that we recognize them, test for them, and then make sure that we are appropriately treating and that the disease is taken care of.
Right. And so how common are they?
They're very common. There are more than 1 million worldwide STIs, typically between the ages of 15 and 49 years old. A lot of them, unfortunately, don't have symptoms, so that's what makes it much easier to transmit because people don't know and they're passing it along.
And you mentioned the age range starting 15. So what is a good age to begin talking to adolescents about STIs? Would it be around that 15 age or what would you recommend?
I would say even beforehand, there have been multiple studies done where they've asked high school age youth, which, high school starts between 13 and 14 years of age. And in asking them about sexual encounters, 31% said that they had already had a sexual encounter before starting this program. So a lot of times it's happening and parents aren't aware. So it's important to talk to them, I would say, in middle school, long before high school starts.
Okay, good to know. And Randy, are there any preventative measures for STIs?
Well, definitely. There's always abstinence. That is the most effective manner. But there definitely are dental barriers. There's condoms to help prevent both male and female condoms to help prevent genital transmission of the disease. There's testing. Testing is very important because, one, you can actually, for instance, in pregnancy, one of the things that we saw even last year in 2023, there are about 69 cases of syphilis that were transmitted to the newborn. So one of the ways we prevent that in pregnancy and transmission to the newborn is testing new mothers who are right when they become pregnant or they're aware that they're pregnant as part of their prenatal testing. So a lot of that is, and of course we use contact tracing and things like that of as far as preventing spread of the disease because often many of these infections can have no symptoms whatsoever, so people may be passing them along and not even know it.
I would add to that, there's also PrEP nowadays, which is pre-exposure prophylaxis. So there's a lot of data using doxycycline, an antibiotic taken right around the time of sexual contact. And that's actually shown about a 2/3 reduction in the incidence of syphilis, gonorrhea, and chlamydia. There's the same sort of phenomenon used with HIV PrEP as well. So if you're having contact with a known partner or even an unknown partner that may have HIV, you can take antiretroviral therapy to help prevent the transmission of the virus.
So similar to that, my next question is what role do vaccinations like the HPV vaccine play in STI prevention?
Well, it plays a primary role. The HPV vaccine helps prevent cervical cancer. That's one of the biggest things that it helps prevent over time. But HPV virus can cause genital warts, but it can also cause cervical issues with women. The One of the primary ways that we actually prevent this disease, and we're looking to prevent cervical cancer later in life, is actually to start offering that vaccine, particularly between the ages of 11 and 26. So that's one of the reasons why and that's a fairly recent development in the last few decades that they've started implementing this. So people of my age, and I'm in my early 50s, that wasn't even an option for us. And a few years after me, up to 46, they were actually still vaccinating. So
I would say we also vaccinate for hepatitis B. So that's also another vaccine that helps prevent primarily the viral infections.
Okay. And oh, sorry, go ahead.
Well, yes, and particularly in adolescents who have not, or even young adults who have not been vaccinated for Hep A or Hep B, can get vaccinated through that, through those ages. So that's a time that they can actually reintroduce that vaccination and acquire immunity through that. What that means.
Okay, good to know. And what are some of the most common types of STIs and how do they differ in terms of symptoms and treatment?
I'm happy to take that one on. So the most common STI in the United States is actually chlamydia. There's about 1.6 annual cases. Unfortunately, many women tend to be asymptomatic, but if they are having symptoms, that usually involves pain during sex. It can be vaginal discharge, or for men, discharge from the penis. If untreated, unfortunately, it can lead to fallopian tube scarring and infertility. Chlamydia also can be transmitted into the throat and the rectum as well. But the great news about chlamydia is it's curable. So if you have it, and we know you have it, or you've been exposed to it, a simple course of antibiotics can treat that. I would say the second most common STD that we see in the United States is actually a parasite. It's called trichomoniasis. It affects women more than men, about a 4-to-1 ratio, and there are about 1 million cases of that a year as well. And the symptoms involve primarily for women, vaginal itching, a frothy discharge, pain with intercourse, maybe vaginal odor. Men tend to be more asymptomatic or not have symptoms. But unfortunately, untreated trichomoniasis can lead to miscarriage or premature birth. So it is curable as well, which is wonderful, and it can be treated with the antibiotic metronidazole, also known as Flagyl. I'd say the third most common is gonorrhea, which is another bacterial infection. There's about 600,000 or so new cases a year. It's very similar symptoms to chlamydia. It also can involve the throat or the rectum. It is curable with an injection of antibiotics, though resistance is becoming more and more of a problem. So with any of these tests, we do recommend a test for cure. So after you have gone between 6 weeks and 90 days after your treatment, we would recommend that you get a repeat test to make sure that the infection has cleared.
Okay.
Randy, do you want to talk about some of the other types?
Sure. Well, one of the other types, particularly, syphilis, in my home state of Maryland last year, chlamydia, there was, kind of building on some of the things that you were talking about, 35,000 cases of chlamydia, 12,000 of gonorrhea, and 3,300 of syphilis alone. So, one of the things that we do particularly is, like you said, the follow-up, 6 weeks later, 3 months later. The other part of that is the syphilis. When we're doing that, we actually test for that using a blood test. Syphilis is quite concerning because it's one of those diseases that will show initially, you'll see like a painless kind of ulcer. And then you might see some lymph node enlargement in the area of the genital region. It can also be in the mouth, for instance, when we're talking about the oral lesions, but again, that painless single solitary ulcer. But then it can disappear. You'll have those kind of febrile symptoms, maybe some lymph node enlargement, but then the symptoms go away. You may see a little while later, a few weeks, few months, a rash in the hands or the palms of the hands or the feet. And then, it can again go away and lie dormant. It can lie dormant for many years. And that's when beyond the first year, that's when we start going into, as approaching the end of the first year is latent syphilis. And then beyond that, certainly latent syphilis. And that's some of the things that she was talking about in the early part, where you have to worry about the heart disease, mind, your cognitive function. Also, just your sight, your hearing, it can affect that. That can be the early signs of what they call neurosyphilis. And so syphilis in of itself in the first early stages, you can get it with a single injection. But when you're catching in those later stages, you have to get a series of injections over about 3 weeks. You get an injection every week. Doxy is one of the other things as far as post-exposure. So, when we're talking about the post-exposure things, you can take a single pill, 200 milligram pill of doxy a few days after you've had intercourse. And that can help, especially if you have been exposed or might not even know. That might be a way you can even prevent it. So again, and this one is a very serious one. Notoriously, Al Capone had this later in life and had some, associated what they called, mental disease as far as that was concerned. So, definitely there's ways of not only testing and looking at it, and of course, follow up with men with syphilis is 6 months and 12 months. Afterwards, you have to get rechecked. But even then, if it's the latent syphilis, you can do 2 years. I've known cases where we've caught people who've had syphilis apparently for decades and thought they treated it, but still had the active infection, and they could have been spreading it throughout that whole time.
Yeah.
I would say probably the most common STI overall is actually HPV, which I know Randy had touched on, but it's pretty astounding that about 3/4 of sexually active people acquire this. So it is incurable. Most people are asymptomatic. They don't even know they have it, which is why it's transmitted so easily. But sometimes it does cause genital warts, and some of the higher risk strains can cause cervical, rectal, or throat cancers. So condoms are good prevention, but it's not 100% effective. So that's why the HPV vaccine is so highly recommended when you're between 11 and 12 years old, just because it is so common, does affect up to 3/4 of the sexually active population, and it could help save you from a cancer down the line.
Yeah.
Herpes. Sorry, go ahead.
Go ahead. That's what I was going to add next, but I'll let
Oh
you go.
yeah. All right. Well, good old herpes virus. There's two types, and the 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 well, the second type technically is probably the more well known of the two, as far as just reputation, is genital herpes. Of course, the first one's type 1 herpes, which is cold sores, but they're not mutually exclusive. You can have herpes, genital herpes in the oral area, and oral herpes in the genital area, and that's where the line can be a little confusing even for the provider. At a surface level, we can't always tell which is which, and both of them are viruses that are with you your entire lifetime. Most people have the type 1. You can get that from just sharing drinks, as children. But sharing a body fluids is how it's transmitted in both cases. But you'll have cases where we'll see genital herpes, but it's or genital infections, but it's actually oral herpes. And we talk about in some of the other as far as how that affects others. I mean, certainly you could be in a relationship, and I had a case of this actually in the past year where we can't tell it apart unless we test it. We literally have to get a swab and then send it off. You can test in the blood, but the blood doesn't say what that is. It may say if you have antibodies in your blood against it, but it doesn't necessarily tell you where and when. You could have had it for many years or just a few months. But in this one case, a female came in with burning and itching in the genital area, and we did a gynecological exam, saw the sores, and tested them, sent them off. And of course, they've been in a monogamous relationship, so we talk about the overlay, trust in the relationships and things of that sort. Was there a spouse, being true to the relationship in of itself? Ultimately, it was type 1. So the spouse was saying, no, I've been involved, only monogamous and everything else, which is an important way of preventing spread of disease. But in this case, it ended up being type 1. It could have easily been type 2 and had a very different outcome. But this type, we treated it with antivirals, which helps it. And there's different ways of managing that with time. With both cases, they actually have the same medicine, acyclovir or valcyclovir. They're basically antivirals, and you can use it both to treat the initial infection, to prevent, to shorten it and reduce it. But you can also prevent the spread of infection, particularly if you're talking about genital herpes, when you're having a spouse who may, or a significant other who may not have it, or if you're having multiple sexual partners. Certainly using the barriers is one of the best ways, but you can also use a daily regimen of an antiviral therapy, and that can help to prevent the spread of it.
Right.
I would add to that, just we get lots of patients who come in, and Randy certainly touched on this, that want the blood test for herpes. And as good as that is, that will tell us in your lifetime, have you been exposed? But that does not tell us if you have active virus. So the best testing is done by a swab of a lesion that we can send out to identify whether it's type 1 or type 2. But the blood test itself, you could have been exposed to cold sores in elementary school, and it comes up positive with HSV1, and you want to, get into an argument or ruin a relationship based on something that you may have had for years and years.
Right. Right. Thank you both for going into those and explaining all of them. I had a kind of a follow-up question. Amanda, you mentioned, what was it? Chlamydia and HPV both can be asymptomatic. First part of my question, I guess, is how common is it that, like, are they more often than not asymptomatic, or does it just kind of depend on, person to person?
It's honestly person to person, but I would say a large amount of patients, particularly women, because our genital organs are inside, so everything's kind of contained. So we often don't realize if something may be a little abnormal. Men tend to become symptomatic and present with these relatively early. Something's going wrong. They're having discharge or burning with urination, that brings them in. But for women, unfortunately, it's hard to say when you are truly exposed, unless you're getting regular screening. So if you had a
That was gonna
screening
be my
last
next,
year and
yeah.
it was negative, and now you're positive, that helps us kind of more determine when the infection happened.
Right. Okay. Thank you for that. I'm going to pause for a second and say, if you're just now joining us, thanks for tuning in. We're joined today by two of our urgent care experts, Amanda Joy, a certified emergency medicine physician assistant, and Randall Wiley, a primary care nurse practitioner. As we approach Valentine's Day, when millions of people express their love for one another, we're here to discuss a very real but sensitive topic that is tied to romantic relationships, and that is sexually transmitted infections, or STIs. Our experts are here to share essential information about STIs in an open and caring discussion, and we have lots more to discuss. So stick around, give us a like to let us know you're watching, and if you have any questions for our experts, you can leave those in the comments below. So back into our questions. Randy, are there any STIs that could affect fertility? And I'll ask that to you too, Amanda. You both want to answer that?
Well, yeah, Amanda even touched on this a little earlier, where chlamydia is is certainly the big one in the room. We see a thing called pelvic inflammatory disease, which is that infection that goes untreated and then continues to fester, and it can spread into the uterus and into the other pelvic region in the lower abdomen and cause all sorts of havoc there, from ectopic pregnancies, which are pregnancies that come and don't stay in the female genital system, but can actually get outside the uterus and form in the fallopian tube, or in even the abdominal viscera, in the stomach cavity itself is what that means. But you can also have scarring, which can be chronic pain, and all sorts of things. But chlamydia is the big one in the room for that. And again, it's very treatable with doxycycline and other ways as well.
Absolutely. And I would say that the big four we worry about with fertility are gonorrhea, chlamydia. Trichomoniasis is less so fertility, but more can lead to miscarriage, along with Mycoplasma genitalium. That's not something we have done a deep dive into here, but it has symptoms that are similar to gonorrhea and chlamydia, but it can also cause pelvic inflammatory disorder. There's about 640,000 cases a year, and this can also cause that scarring, lead to ectopic pregnancy, and potentially some fertility issues. That one is also quite curable. We can treat it with antibiotics, but it's not in your normal panel of STIs. A lot of people are just carriers of this bacteria, but if you're looking to get pregnant, it's important to look for this. If you're having symptoms, it's important to look for this. But I would caution you to put this in your routine screening. This is more for folks who are continuing to have symptoms despite negative testing on other more common STIs.
Okay. And my next two questions are ones that we've definitely touched on, but I think is important to go over again. So first is, what are some of the first symptoms someone should look out for or be aware of if they think they may have an infection? And I'm sure it's different depending on the infection, but maybe just some general things that people can be on the lookout for.
Sure. Again, a large part of that is just changing urination. Having that burning when you're going to the bathroom, any discharge you're seeing in the area, any lesions in the genital area. I mean, any things from ulcers to redness to itching to, if you're anything that's swollen or, changes in the genital area is important and something to look into, particularly if you've had some of these other risk factors.
And I would say for women as well, if all of a sudden you start having pain during intercourse, that may be an indicator that something's wrong.
Right. And what's the first step someone should take if they believe they have an infection? And what we've talked about this, but what tests are available?
So I would say first step is to come on into your primary care, your GYN, your urologist, our urgent cares, and we are happy to do some testing for you. Some of the tests that are available can actually be done at the time of the visit. The FDA has fortunately approved HIV testing in men and women that we can do on site. And rapid gonorrhea, chlamydia, and trichomoniasis. It's currently approved for women. It's in the process of being approved for men, but you can get your answers that same day. But we also have send-out tests. We can do send-out tests for the herpes, the hepatitis, for men, gonorrhea, chlamydia, trichomoniasis. We can swab you for gonorrhea, chlamydia, trichomoniasis in the throat or in the rectum if need be. We can test you for syphilis as well. And if you were to have a rapid test that was positive for HIV, we would then send out confirmatory blood work and help you with that. If you're concerned about HPV or human papillomavirus, that is when you should see your family practitioner or GYN. That is best tested with a pap smear. So we would refer you to those sort of services. So that's not available in urgent care.
Okay. Good to know. Yeah, I feel like that's almost sometimes the hardest part is knowing where to start to find the care that you need. And how would you encourage someone to get tested for an STI? I guess maybe how would you approach that conversation with, somebody talking to their partner about it, or as a doctor, how would you approach that?
It can be both, so as a provider, you just have to, you have to be comfortable talking about everything. That's really what it is. No subject can be taboo, because you could be exposing them to a risk just not by approaching it. You have to be comfortable talking about these things, and because often patients are very uncomfortable, and even when they're coming in, they may come in for one reason. You get hit with that, oh, by the way, this is the real reason I came in, and that's not uncommon. Actually, you see that a lot in the primary care environment. But being able to talk about that honestly and openly with your kids, especially in the middle school age, as they're approaching the adolescent years, is very important. Certainly, with under 25, if you're sexually active, getting tested every year, with as men and women, you can do that. It's one of the good primary care interventions that you can do, just to get tested. Certainly, if you've had some high risk behavior recently and you're just concerned, I have patients that come in a couple times a year and get tested just because they're just engaged in that behavior. They may or may not want to take the preventative testing, but a lot of it is just education, having that dialogue.
Yeah.
I would mention with that, many insurance companies will only pay for one screen a year unless you have symptoms or other high-risk behaviors. So it's important for us as providers to understand why you want to be treated. So if you think, oh, I'm just going to tell them I want a screening done, but I'm actually having symptoms, then you may get an out-of-pocket charge for that, and we don't ever want that. So I think having an open and honest dialogue with your providers is good. I think trying to, as a provider, make the patient seem to understand the role more, understand the why. Why are we testing for this? Why do we think this is important? And then recognizing that discomfort, and then just having a frank conversation with them about it, and making your recommendations. It may be hard for some people to hear, but it's important for them to hear.
Yeah, definitely. It's definitely a topic that I think as a patient can be scary to talk about or uncomfortable to talk about, but like you said, it's important and necessary too.
Often, with the stigma that's attached to these subject matters, and that's really where a lot of it lies, is that people are afraid to have that conversation. So even outside of the primary care environment, there's other venues. So the state of Virginia, state of Maryland, you can actually go to the state website and actually have them send for home tests. You can get home tests for HIV, a home test for some of these other issues, chlamydia, gonorrhea. And of course, if those are positive, you can go get tested or treated by your provider or at the health department. And again, that's the other thing, is you can just go to your local health department and get free testing and treatment for these issues. And so that's another way, with the public health nurse or the public health provider at your local public health office. Planned Parenthood is another way for access to treatment. But removing those barriers is very important, because often if you're not treating these things, they're spreading, and often it may not be known that they're spreading.
And that kind of goes into my next question. Are there any specific STI related health services that people can turn to if they need help? I know you mentioned Planned Parenthood and
health department.
Yes. And is there other services that they can provide, educational wise, or other health services that provide those sorts of things?
Absolutely. Especially DC has a ton. My favorite is Whitman Walker. It's a wonderful clinic, and it's not MedStar, but it's a wonderful clinic that has resources for patients, whether you have insurance or not. They have folks who will work with you to help you get insurance. So if you've come in and you've had a screening for something and it's positive, and it's something that we can't just treat on the spot, let's say HIV, for example, then they are able to take on your care from there, get you the insurance you need, and get you the help that you need. So there are these services available all throughout the country. So I think it's important for providers to know what's in the area and where can you send patients to get that assistance.
Yeah, for sure. And if someone is diagnosed with an infection, I think I know the answer to this, but should they share this information with a current or future partner, even if they are cured?
Well, the answer to that is yes, because if they're cured now, but it also depends on timelines. When they're exposed and who was exposed. That's an important thing. Certainly, many of these that are incurable can be in remission for years, and the person's may not know whether they've been spreading it or not. Herpes is a great example, and HIV as well. So it's important to be open where you can. But again, there's relationships are tough, and people don't always communicate. So there's providers in some case are actually require mandatory reporters. So with some of these, we have to actually report it to the health department. We don't go around telling your partners, but certainly there's a need, as particularly with syphilis. Often we have to contact trace it to other folks, and see where the spread is. We saw that on the West Coast, where I used to do a lot of practice out there with syphilis quite frequently.
I think part of the problem is many people don't really understand all the nuances of what's curable, what's treatable, what's in remission. So you could say, oh, I'm cured, I'm not going to tell my partner, but you may be wrong. Maybe you were just in remission and you weren't sure. So I think it's always a good idea to have those conversations, and maybe make an appointment together and go get tested together before you start having any intimate relationships.
Yeah.
Understanding some of the tests are important, because especially like syphilis, there's a test called an RPR, which will remain positive for a lifetime, but doesn't mean you have active infection. It just means you've had that exposure and may have been cured. But there's that possibility you may still have it. So there's what they call reflexive tests, where it may have an initial positive, similar with HIV, but it'll reflex and test specifically for the antigen, or the disease-causing element, and that may in fact be negative. So sometimes we'll get an initial positive, but ultimately that person is negative for the disease.
Right. Yeah, it's once again could potentially be an awkward conversation, especially if it's with a new partner, but one that's super important to have. Um, so my last question for the two of you to wrap things up, if you could have people remember one thing about STIs or the message that they should take away after watching this broadcast, what would that be? Randy, I'll start with you.
Well, it was on the tip of my lips. Prevention, is really the best way, because once the genie's out of the bottle, as they say, it's hard to put back in. But using barriers, getting tested if you're sexually active, um, you know, understanding the behaviors around it and what risks it exposes you to, IV drug use, with HIV. When you do have an STI, it actually leaves you more vulnerable to things like HIV, because it breaks down the natural defenses that you have um, in the genital area, in the oral area. So those prevention is really the mainstay.
Yes. Amanda?
I would say that millions of people suffer from these every year. We were talking about hundreds of thousands to millions in each category. So you are not alone. If you are having these symptoms, it's way more common than you think it is. It is not the end of the world. We can help you navigate treatment, next steps, those sort of things. I find people get very anxious and upset about it, and it really can have a profound impact on their mental health as well. So it's important to know you're not alone. As providers, there's no judgment. We want you to be open and honest about your practices. It helps us protect you and your current and future partners.
Yes, I love that. Those are both great notes to end on. So, thank you again for joining us and answering our questions. We really appreciate it. To learn more about the services we offer in our urgent care centers or to request an appointment, visit us online at medstarhealth.org. And we'll be posting that link in the comments as well. Thank you again, and we will see you next time.